To me, there's only one solution. And that's what I talked about last time, and I think it's even more viable this time. And that is embodied in a bill that I wrote, H.R. 676, the Conyers-Kucinich bill for Medicare for All. And here's how it works. Basic numbers. $2.2 trillion a year spent for health care in America. That's about 16% of our gross domestic product. 31 cents on every dollar goes for the activities of the for-profit system. Corporate profits, stock options, executive salaries, advertising, marketing, cost of paperwork, 15 to 30%. Approximately $660 billion a year. You take that money and you put it into health care. So that all the $2.2 trillion is spent for care for people. Suddenly you have enough money to cover everyone in the system. All basic health care needs, plus vision care, dental care, mental health, prescription drugs, long-term care, all covered. What's lacking is political leadership. Now, in the Las Vegas debate that we had a month ago, two of my friends who are candidates and made the comment that, well, there's really this idea of single payer isn't really viable. You know, never pass. You know, alluding to the interest groups that are out there. Think about this. If someone sees himself as being President of the United States, and you would assume that you don't run unless you could see yourself in that position, how then could you see yourself being President and simultaneously be subordinate to these powerful interests? I would be very concerned about electing anyone who didn't believe that the President of the United States couldn't rally the American people in the cause of their own health. And so that's what I intend to do, to rally the American people. Franklin Roosevelt saw a country in the 30s that was in economic decline. And he knew the way out was a New Deal. Jobs, health care, Social Security, having the regulatory agencies work, protecting people's investments. This is all part of a New Deal. And he went out and campaigned for it. He brought in a whole new Congress based on the principles of the New Deal. I'm talking about taking America in a direction where we rally the American people to create this not-for-profit healthcare system. I think the public support is there for it.